Good morning. It's Friday, and we're going to get started with our first case. This is a lovely young lady who's a mother of 8 children and has not only a diastasis but a little umbilical hernia. That's a separation of the fascia there where the belly button is, and we have to fix that to get a good-looking belly button. We're also going to lift and augment a breast. Labiaplasty as well is going to be part of the day's plan with aggressive liposuction in the back and flanks. So we'll get started. So these 2 points right here are going to be brought down to this point, 1, 2, 3. We're going to bring those points together. To do that and to get that to work, the skin that's down here on the bottom has to be removed. A lift and a reduction are really the same operation with one exception. And the exception is that with a lift, we just remove the skin. With the reduction, we remove skin and breast tissue. Once we bring all that down, shape it out, we'll bring the nipple and areola out right here in headlight position. And then, of course, we'll be augmenting that with an implant. The implant isn't so much for volume in this case as it is for shape. She's got what a lot of women have after having children is in a few years of aging is just that her breasts are deflated. There's not a lot of density to this breast tissue anymore. So we're going to get to work. Scenario, we're adding volume and subtracting volume in the form of loose skin on the bottom. Just set them up with some sizers. All right, guys, thanks for checking back in. These are great visits. We're 4 months out from this procedure, which is usually when we judge outcomes, and we get to see our work. Very pleased here, and I hope our patient is too. If you remember, she had 8 children. We did a breast augmentation with a lift and a tummy tuck, and she's been kind enough to participate in an exam today, so we're going to take a look. All right, thank you for doing so.
Yeah,
we'll
no
just
problem.
stand right here.
Yeah.
And to take a look. So some of the things, do you mind if we take this off actually? Yeah. Some of the things that we looked at here, where her elbows break, we see elbow flexion creases, then we see the creases under her breast, nipples, and clavicles. And that's sort of a perfect, or what we think of as ideal configuration. Of course, with 8 kids, there was a lot of muscle work. We did an umbilical hernia repair, great looking contour. And I'm just going to get you to turn a little bit this way. Put your arms right here. And this is something else I want to show you. This curve that we see right here, actually, I'm on this side. The curve that you see right here is super feminine. And again, where attention to detail is concerned, we want to make sure that we're taking the scar around far enough to get the skin excess, but also that we're using liposuction to contour appropriately. In this case, we went up on the upper back as well. Very pleased with all that. So thank you again for doing that.
Yeah.